Hey everybody, welcome to my video on fluid and electrolytes. I decided to make a video on this topic because it's really difficult for everybody to understand. Even I get confused sometimes when I start reviewing information or talking about it in class. So I decided to go all magic school bus and do visuals on a microscopic level, and to see if maybe some visual representation will make it a little bit easier to understand. So let's dive into it. Let's misfrizzle it and see if we can make it a little bit easier. All right, with fluid and electrolytes, whenever you hear the word fluid, I want you to think water. Okay, this is similar to water that flows around inside our body. These large circles on the paper represent the cells in the body. And inside our cells, we have some fluid that is flowing around that helps keep us hydrated. That is what's called the ICF, or intracellular fluid inside the cell. That fluid is kind of stored for later. We hold on to it, it's harder to lose. But we also have blood vessels that kind of run through our body that also have fluid and water just circulating more freely. That water is called ECF, or extracellular fluid, because it's outside of the cell. That fluid runs more free, so it's easier to lose. It kind of enters and exits the body more quickly. This is one of the reasons why we talk about this in pediatrics, because kids are really at risk for dehydration. They have a larger percentage of extracellular fluid, the ECF, that kind of runs out of the body quickly. And so they don't have as much reserve. They don't have as much stored in the cells. Especially kids under 2. They're at really big risk of becoming dehydrated, and that can be fatal for them. Okay, so we've got water inside the cell and outside of the cell. In our vessels, we also have things like our blood components, like red blood cells, white blood cells, platelets, those kind of things. So that's what those red dots represent. All right, the other thing we got to mention are the electrolytes. So when it comes to water and fluid within our body, it greatly impacts electrolytes like sodium, or Na, potassium, K, chloride, Cl, calcium, Ca, and magnesium, Mg. Notice that these things are both inside our cells and outside of the cells. They kind of move back and forth, and it's a balancing act. We kind of want equal levels of water and electrolytes that can move freely throughout our body. Whenever dehydration occurs, it doesn't mean that we're just low on the water part or the fluid. It can be low electrolytes too. So whenever we talk about dehydration, when we lose equal parts of our fluid and our electrolytes, it's called isotonic dehydration. So you can see in the vessel, we've kind of lost both of those things. Then sometimes we lose more fluid than the electrolytes. So in this picture, we have less water, but our electrolytes are still there. That's called hypotonic dehydration. Lastly, we can lose more electrolytes than fluid. So in this picture, our fluid's still there, but our electrolytes are missing. That's called hypertonic dehydration. So all these terms are just describing what we're losing and how much. Okay, the proportions of both of those things. Now we can see this type of dehydration in lab values. Whenever we draw labs, we can notice that somebody's dehydrated. One of the things that we'll kind of look at are hematocrit levels. Hematocrit levels with dehydration are going to be elevated. Okay, let's talk about why that is. Hematocrit measures the amount of red blood cells in the vessel. So when we lose a lot of fluid, your blood becomes more dense with red blood cells, right? So the water is gone in this picture. And so we've got a lot more of those red dots that are flowing through. They're more concentrated. So since hematocrit measures that concentration, it's going to be a higher value. Another thing that we look at is BUN. BUN stands for blood urea nitrogen. and it reflects kidney function in the body. When we become dehydrated, our kidneys become stressed. They need fluid in order to function. So since they're stressed, that BUN value is going to increase. It means that our kidneys are asking for help. They need some water. Lastly, the thing that we look at is specific gravity. We can look at specific gravity with blood or with urine. Specific gravity is talking about how concentrated something is. So when we're dehydrated, our specific gravity always goes up. Because we have less fluid, our red blood cells are more concentrated. Also, our urine is more concentrated, right? We don't have all that water to kind of dilute it, so it's thicker and has more particles in it. Lovely. So anytime we're dehydrated, our urine looks gross and our specific gravity is high. All right. Besides fluid and electrolytes, whenever we're dealing with dehydration, there's something else that we always look at, and that is our body's pH balance. Okay, so with pH within the body, our normal range is 7.35 to 7.45, and that's something we just have to memorize. Whenever you're thinking about pH balance, I want you to picture it like it's a tug of war. Okay, we've got different factors that are pulling our pH either higher or lower. One of the things that influences the pH is HCO3, which stands for bicarb. Bicarb is on the right side of the picture because it pulls your pH higher. It is Team Bicarb is pulling our pH to the right above 7.45. It is a basic element, meaning that it influences our pH to be a higher number and makes our blood more basic in property. Then on the other side, we have the opposing team, which is CO2. Okay, so Team CO2 is on the left side of this picture because it pulls your pH to be a lower number. Carbon dioxide is an acid. So the more carbon dioxide you have, the more acidic your blood is. It pulls that rope to the left. It is pulling your pH towards the acid portion, which is less than 7.35. Okay, so CO2 makes you more acidic. It has a lower pH. And bicarb makes your blood more basic or a higher pH. And it's a tug of war between the two of them. We want them to be pretty equal in strength, so that way we can stay in a normal value. All right, so anytime we have a shift with CO2 causing a change in our pH, that is going to be a respiratory change. So we either say it's respiratory alkalosis or respiratory acidosis if our CO2 is what's causing our change. Now on the other team, whenever we have a shift in pH because of bicarb, that's related to digestion, which that picture is supposed to be the stomach. I'm sorry if you can't see what that is. I tried my best. But Team bicarb is related to your metabolism. So whenever there's a shift in pH because of bicarb, it's going to be a metabolic change, either metabolic alkalosis or metabolic acidosis. Okay, so let's talk about instances. Since we're talking about dehydration, we're usually talking about something metabolic that shifts our bicarb. So first, let's talk about if we have vomiting, what happens. When we have vomiting, we lose a lot of our acids, right? We're losing stomach acid. We're losing those things that we normally digest with. So the acidic team CO2 on the left, is losing, right? Because we've lost a lot of those acids. And Team bicarb is going strong. There's less acid to work against it. So Team bicarb is going to end up being the winner in tug of war, right? And our pH is going to be higher than 7.45. Since bicarb is causing the shift in pH, it's going to be called metabolic. And since it's a higher number, it's going to be alkalosis. So the shift when you have vomiting is metabolic alkalosis. Bicarb pulls our pH higher and more basic. Now let's talk about if we have the opposite. What if we have diarrhea? Oh boy. Okay, whenever you have diarrhea, you're gonna lose bicarb. Okay, we excrete a lot of bicarb through our diarrhea. So team bicarb is not gonna turn out real good this time. They're gonna lose some team members. Some of their team members get excreted through diarrhea. So when that happens, the basic team loses and our acidic team wins. And so your pH actually shifts lower. You have more acidic pH, less than 7.35. Okay, even though we're saying this favors team CO2, the shift in pH is still because of bicarb, because we're having this diarrhea. So this is still a metabolic change, and this time it's metabolic acidosis because we're becoming more acidic since we lost that bicarb. Okay, so a way to remember this is if it comes out of your, you know what, then you're gonna get acidosis. All right, hopefully I didn't get fired with this one. I hope this video helped. If you have more questions, just ask and you can always watch it again, okay? We got this.